UWITV now presents a special COVID-19 Symposium hosted by the Caribbean Public Health Agency CARPHA on March 11, 2020 in Trinidad and Tobago. Part 2 of the symposium features a roundtable discussion with media stakeholders from around the region.
As we will move into the next segment, which is the roundtable discussion, I would like to take the opportunity to introduce you to the members of the roundtable. Our moderator is Mrs. Fane Richards, journalist, presenter, and producer at Guardian Media Limited. Ms. Kiran Maraj, President, Trinidad and Tobago Publishers and Broadcasters Association. Mr. Wesley Gibbons, who is the Executive Member, Association of Caribbean Media Workers. Ms. Natalie Lagore, journalist and talk show host at I-95.5 FM radio. Dr. Stephanie Fletcher-Larty. Dr. Fletcher-Larty is the consultant for communicable diseases and emergency response at CARPHA, and Mr. Oren Gordon, who is a freelance journalist. I want to turn over right now to Mrs. Fane Richards, who, as I mentioned to you before, will be our moderator for the roundtable discussion. The way this is going to flow, as I said, Fane is the moderator. Each panelist will speak for 5 minutes. That will go according to the agenda in terms of what they will be discussing, and then we will again open the floor for questions. Fane?
Thank you very much, Ms. Fitton, and as well to the executive team from CARPHA for having all of us. Good afternoon to everybody, to our audience in-house and on the live streams online. I'm not going to occupy too much of the start time here, but I do want to connect what I think was a great change in the program, allowing for some questions and answers to be asked at this stage. Because I think it shows that we in the media are on the same steep learning curve that everybody in the public is on around the world. We are asking questions that any member of the public might have been in here asking in an effort to at least get our own baseline understanding of what we're dealing with so that we can then convey that information on to the public. So that's a good framework for us to keep in mind as we discuss the media role in this global outbreak, our expectations of the accessibility with public health resources and personnel, accessibility to information, the obligations that we have to be fair and responsible in our reporting, and the collaboration that we as a region must have so that we can get information shared amongst ourselves and keep that evil misinformation phantom that really lurks over our shoulders every day thanks to WhatsApp, Facebook, and all these other things. And really strengthens our calling to have to debunk so much. So we're in an interesting cocktail of ingredients here. We have mystery and the unknown. We have cross-border spread. We have numbers. We like numbers, especially ones that keep going up. And of course, the main ingredient, fear, anxiety, worry, concern. That is the milieu of circumstances that we are trying to do our jobs in every day. So I want to start with the gentleman to my left, Mr. Oren Gordon. He is last on the list, but I think in terms of topic priority, media expectations, it's a good way to set the tone.
Thank you very much, Fane. Good day, everybody. This is a very timely subject, a timely event, timely discussion, and I'd like to thank CARPHA for taking the time to organize it. I want to touch briefly, and I'll stay within my 5-minute lane. As an old radio man, I know my time to a second. I want to touch briefly on 3 areas. One is information management, concerns all of us. One is implementation, and the other one asks the questions of what the medical authorities are doing to help the retail sector to get the needed supplies so that we may be able to buy them. So my plan this year was to visit Japan for the Olympics and South Korea. I think that those plans may have to be put on hold, to say the very least, because from all indications, it is going to be logistically impossible to organize the Tokyo Olympics in June and July. I just can't see it happening with so many potential infection touch points regarding the virus. South Korea has been one of the success stories in terms of testing and containment, but still that part of the world remains a high-risk area. I just thought I'd throw that personal anecdote there. I will have to revise the bucket list a little. I want to talk a little bit about the United States because as of this morning, the number in the United States crossed 1,000. And the United States is a big worry for the Caribbean because just for Trinidad and Tobago alone, we have 3 touch points. We have Texas, we have Florida, and we have New York. I'm going to offer an opinion that is a non-medical opinion, but based on probability. I believe it's already here. Sorry to shock you. I believe it's already here, but it's undetected. And I think Tony Fraser used the word inevitable. Based on probability, my hunch, and I'm probably going to get slammed by the medical professionals for saying this, I think it's already here and you guys just haven't detected it yet. And the sad thing about the United States is that the president is a very unreliable partner. Can you let me finish, please? No, I will bash President Trump. He's an unreliable partner in the management. I'm a journalist. I talk it as it is. He's an unreliable partner in the management and containment of the virus because the things that he has been saying, that the cases will be down to 0, was when they were at 15 and now they're over 1,000. And his enablers in the media have been defensive of his response to the management of the crisis because they think that his political opponents in an election year are using it to hurt him. So these are things we need to be aware of because President Trump's intransigence will cost lives in the Caribbean. And so I beg your pardon for being very critical.
You have to beg many pardons.
On that score. So
because CARPHA is not about bashing any president or prime minister.
No, this is my point of view.
Well, we will make sure that it is registered as yours.
Yes, yes. And I stand by my point of view. Implementation. In 2014, I was traveling a lot in West Africa for work. And as soon as you got off the plane in Lagos, you were met with a line of people in medical garb with things that look like guns, right? And before you got to immigration, they pointed it to your forehead and they took your temperature. The question I would like to ask my medical brethren and sistren is whether we have such controls in place for arriving visitors at Piarco Airport and other ports of entry. I'm told that we do, so that is a good thing.
And we have signage in Trinidad because I came in yesterday. We have signage in Trinidad in almost every language known to man.
That is a good thing. I haven't passed through the airport in a while, so I thought I would ask the question within my presentation. And lastly, I would like to touch on the availability of the things that we need now and the things that we are going to need in the future. On Saturday, I was on my way to a show in Movietown. I left my hand sanitizer, Movietown, Port of Spain. I'm aware that there are several of them. I left my hand sanitizer at home. I stopped at one of the gas station convenience stores to try to see whether I could get some supplies. And they were out of them. I know it's only one example, but I'd like to find out from the folks gathered here if there are ready availability of the things that we are told we need to contain the spread of the virus. Hand sanitizers, wipes, and masks are becoming a thing now. And more people are buying them. And that is I've spoken for 4 minutes and 39 seconds, and that's the note on which...
We're just talking about that.
That is the note on which I would like to end.
Good.
Over to you, madam.
All right, thank you, Oren, very much for the questions and the anecdotes, and perhaps not so much the opinion, but I think CARPHA will forgive you. All right, let me turn it over now, working my way to my right, to Ms. Kiran Miraj, who is the president of the Trinidad and Tobago Publishers and Broadcasters Association. She has a couple slides that she'd like to use as part of her opening statement.
Thank you. Good morning, and first of all, let me thank CARPHA for doing this, because I think the media is very essential. I want to thank you for cooperating with us and pulling this together for our region. It's so necessary. So I decided to put together a few slides. I'm going to be very brief, but to contextualize what is really the media's role. There are two movies I always hoped I would never have to live through: Contagion and Day After Tomorrow. So when coronavirus hit, I said, oh my goodness, Contagion has come to life. And you know, the human side of us wonders if we should panic or not. We are not supposed to panic, and that is the media's key role. Right now, we have to educate and inform accurately. We have to use reliable sources and experts. At times like this, when fear becomes evident in human beings, you have predators, and so that is where the fake news steps in, particularly people who realize words like coronavirus and COVID-19 are trending. They will put up false websites, false news stories, and disseminate misinformation. So let us be very careful. CARPHA's site is very reliable. I've been monitoring CARPHA, WHO, PAHO, and I want to really commend CARPHA. I think they're doing a tremendous job, and that to me should be our first stop when we need expert advice and information. Talk show hosts, we need to be in control. I say we, media industry, journalists, newsroom managers, managers of media. We all have to be in the part of the process, and we need to also monitor a lot of the talk shows. The talk show hosts have to become walking encyclopedias for the dissemination of information, because the issue comes when our callers may hear something and they say it on the air, and the listeners don't realize the difference between the caller and the moderator or the host. And so what happens is that they hear that little bite, they tune in 15 minutes, you know, they leave the radio or the television and they start saying, but I heard on station XYZ, ABC. And so we have to ensure that we keep reeling them in. We have to fight misinformation by verifying facts and truth, and we have to be careful of reposts. We have to manage our social media where rumors can live. And you know, people love to repost things, so we have to be very, very vigilant with how we do that. We have to maintain stability, do not cause panic. This is a time for us to take precautions and not cause panic. I don't know how many of you understand the power of social echo, but I just put in an example here with a BBC article in January. It was reposted over 24,000 times, over 880,000 times on Facebook, and they had over 12 million reads. So we have to be very mindful of what we do because of that social echo. So what is it important for us to push? We must constantly remind our population about the symptoms, about the testing process, and we learned a little bit about that earlier. I would really like to see CARPHA produce some kind of information poster about the process. We need to keep our audiences in the loop with where they go to if they think they're suspect. What about how to avoid spreading germs? I learned yesterday that when you wash your hands, you have to lather for at least 20 seconds if you really want to get rid of germs. Some of us just turn off the taps. You know, that's not what we have to do. So even down to that. And then again, updates from key sources. So ensuring that we constantly remind our population about protective measures is very, very important. So then what information is it important to pull? Because remember that media is a feedback mechanism. We get information from the public we serve as much as we give information. So we have to constantly understand what their fears are. We have to pull that information forward, and part of our job is allaying those fears and being the intermediary between the experts and the population to get insight into the questions the public has. So questions become important. And then rumors. We don't want to spread rumors, but if there are rumors, we need to dispel them. And that is very, very important, especially with talk radio. And obviously, we have to offer beneficial suggestions. So it means at this time, we have to be constantly in the loop with our knowledge and information. So how do we communicate the messages as media? We have to use all of our channels. We are no longer in an isolated newsroom of just radio, TV, or newspaper. Remember that we have social media. So on air and printed, we want to simplify the information. We want to keep the information consistent. We should be doing regular updates. The use of infographics is very important, especially for the younger population, because we know how important Instagram is in particular. So we want to use infographics to dumb down the information, but to make it meaningful. All of our staff should be informed. I had two people on staff who said they just got a little bit of the flu. I was like, you know what, you go home and stay home until it's cleared. Because at the same time, remember that people's immune systems are important. And we have to push that too. You know, eating properly, taking better care of yourselves at this time. Because if you do, for any reason, get the virus, you want to be able to fight it off. So the other aspect is our social media. We are very good at social media in our newsrooms, I think, in Trinidad generally. So we have to constantly simplify the information, encourage questions, and get feedback to improve the information flow. Again, keep it consistent, do updates, use infographics. When our users on our social media put up certain things or ask questions, we have to ensure we could be there to respond. So the workload on us is going to be a little bit more. It's not going to be a walk in the park or a vacation time for any of us in media right now. So we have to be prepared for that ourselves. And mobile media, a lot of us now have WhatsApp numbers that we do our shows with. We should be sending news alerts to people. We should encourage questions, especially when we're doing our talk shows. We should generate interest for our content as well. And this is the time when we need to utilize our airtime to talk to people like representatives from CARPHA, PAHO, or WHO, or the Ministry of Health. This is the time when we have to pull together. So I hope that this helped contextualize how I see the role of media for us in this. Thank you.
Thank you very much to Kieran for that presentation and for really putting it in an easy to digest manner, how complex our role is in a situation. We are still trying to understand what we're dealing with. So there's a lot of, as she put it, push and pull on us in very tight timelines, especially when you're dealing with fake news that is spreading long before you necessarily get your answer to confirm or deny. You have a lot that you have to keep up with while you're dealing with all of those factors. Let's turn it over now to Wesley Gibbings, the executive member from the Association of Caribbean Media Workers, who's here with us today. And he's going to talk to us about how we, within the region, can collaborate in reporting on COVID-19.
Thank you very much, Fane. Thank you very much, CARPHA, for facilitating this event. Now, some of us who have been around a little while now, my much more senior partners, such as Andy and Tony, at least 30 years ahead of me, would know that in an episodic, but even though an ongoing way in a sense, the interface between health communication and journalism is one that has frequently been something we have had to manage and to be a part of. In journalism, you look at those sort of survival issues in which the classical requirements to be fair and balanced apply, but also the whole notion of the public interest is dominant more than many other areas of concern. So when I looked at the COVID-19 challenge, it occurred to me that along the way, we had another challenge that closely mirrored what we are going through now. And some of us here have been associated with via this interface between health communication and journalism. And that has to do with the HIV and AIDS challenge that we face and continue to face in the Caribbean. And what are some of the lessons learned through the HIV/AIDS challenge, and to what extent do those lessons apply to the current situation with regard to COVID-19 and the coronavirus? Stigma and discrimination emerged as one of the earliest phenomena to be addressed, both with HIV and AIDS and with the coronavirus. And it expresses itself in many different ways, socially, in terms of people who are shunning people of various ethnicities and so on, but it also expresses itself in terms of the languaging of our reportage. So I'm seeing in some other media, not here in Trinidad and Tobago that much, though in casual conversation it does come up, I see continued reference to the Wuhan virus. When the scientists have gone way past this notion of the virus being, quote unquote, a Chinese phenomenon to be avoided, and in the process people are interpreting that to mean avoiding the people from China or Chinese people. So you saw that in some instances, Chinatown in Toronto and New York and London and so on, under serious problems. And people like myself who look at these things very carefully started asking the question, when Italy was affected, whether pasta and pizza was experiencing a similar decline in popularity. So stigma and discrimination, and in this round with respect to COVID-19 expressing itself in terms of racism and xenophobia. The use of language, as I said, is very important. Language, images of fear and panic. In the early days of HIV/AIDS coverage, there was a tendency to focus on the gory images, the emaciated patients in the hospital rooms and so on. And even with the endorsement of international public health authorities, who all thought that if you showed people what happens to someone because of their own behavior, and that the shock value would be such that people would restrain from the irresponsible behavior that was leading to HIV infections. And that, of course, turned out to be untrue and inaccurate, and the spread continued notwithstanding. So those people who believe that the shock and fear approach is effective, we have the experience of HIV and AIDS to know that spreading fear and presenting shock and using language to signal something that's deadly. So every time I see the deadly COVID or deadly it hits me because we went through this phase with HIV and AIDS, and it added to the stigma and discrimination that had to be addressed. The other challenge is the challenge of precision. And journalism is a profession of precision. So we cannot be fast and loose with the figures and the estimates and the countries and so on. The other thing about it in terms of journalism is that so very often these things tend to be covered in a very one-dimensional way. So in some of the countries, the tourism sector is very seriously affected. And there is an emphasis, and perhaps there's a lack of balance with respect to the challenges that other sectors are confronting, because there are broad business challenges, there are challenges with respect to the education system, the health sector, and so on. The other thing that goes unnoticed sometimes is that there are vulnerable groups and communities and people. I saw a story out of the United States yesterday, I think it was, that placed emphasis on the plight of the homeless. And the extent to which some of our societies might well be missing this constituency, this group of people who don't have ready access to the means of communication that most of us do. And even we consider it as the rest of us having this sort of access. Not all of us do. Social media access in Trinidad and Tobago is 67%. And so you realize that if you're using the traditional, the main social media platforms, you're still, even they're not reaching everybody. So mainstream media becomes important, and of course the growing role of WhatsApp, which is sort of straddling interpersonal communication and social media. And finally, I think I'm within my 5 minutes, there's the vulnerable groups, but there are also the privileged groups. And the groups of privileged people who are bypassing the public health system. Before I came here, somebody called me to say, look, I heard about 2 positive tests done at a private institution. And this is not by people who didn't go to school or who are living on the streets. These are people who think that they can buy their way around the public health sector by going to private hospitals that are offering the service, in some instances at great expense. So that's a group of people that we need to pay attention to as well, because these are people who are bypassing the public health sector willfully, as opposed to those people who don't have access to the communication, the homeless people and others who are there. And finally, in terms of dealing with these issues, I think that I have been advising a lot of people who are coming with 1,000 different posts that they're seeing on Instagram and Facebook and Twitter and so on. And the best advice you can take is, and Kiran addressed this issue, is to narrow the sources of authoritative information as much as possible. So the people that I'm talking about, the groups or the institutions I point to are the Ministry of Health, CARPHA, PAHO, and the WHO. There are all kinds of other things. Somebody posted a fake news thing up from UNICEF the other day. And I thought it odd that UNICEF would have something that's at variance with what the WHO is putting out. And this was with respect to temperatures or something like that. So I think that's my 5 minutes. Thank you.
Thank you very much, Wesley, for that. And Ms. Curtin informed me that in the time we've been talking, that the WHO has officially declared it a pandemic, which is of interest, and it was actually something I wanted to bring up today because CNN independently took that decision this week. Their editorial board released a statement and said that the epidemiologists, the scientists, they all say that the criteria had been met, and whether or not any global agency wanted to go ahead with that they thought it was important to treat it within that context. So we can discuss that after we hear from our final two panelists this morning. So I'm saving the doctor on board this morning for last because we're trying to set the media context and then have her come and bring up the rear with things that we need to make sure we are cognizant of to get accurately and correctly. So we're speaking now to Ms. Natalie Legore, our talk show host and journalist. She's going to give us perspectives from behind the microphone and perhaps address what Kieran mentioned about reining in those callers who want to run away with their own panic, concern, fear, and fake news. And she, of course, a talk show host on I-95.5. So let's turn it over to Natalie.
Thank you very much, Fane, and thank you to CARPHA for organizing this. We need it. And I hope that it's not a one-off event because, you know, being behind the mic, I can't tell you how rough it is sometimes with the misinformation, the rumors, the propaganda, deliberate sometimes, and sometimes not deliberate, but it exists. So good afternoon to all of you. And thank you for those of you who came out, because I'm telling you, when I tell you that we needed this, I can't tell you enough. And especially being a talk show host is sometimes, you know, it is so difficult because people believe that as a talk show host, they forget that you're a journalist and they believe that you're just going to go with whatever is there and whatever is hyped up and whatever, you know, is trending at the time. I don't see things like that because I'm a journalist first before I'm a talk show host. So this is a quote from Frank Comito, CEO of Caribbean Hotel and Tourism Association. And he said, panic is more contagious and damaging than the virus itself. Isn't that the truth? Because I definitely agree with that. Because I've had to dispel rumors about the Venezuelans coming here, why they came here, how many of them are here, without any statistics, any data. It was just so much, and then you have to try to balance and go through what is real, what is fake, and try to get the audience on board with that. So when you started spreading like wildfire about COVID-19, I just knew that I just had to arm myself. So the research started like rapid. What do I need to know? Who do I need to speak to? So that I can be in a better position to inform the public, because when people call you on the radio, a lot of times they're calling you to be the experts, They expect you to know everything. So if we don't do our jobs, and if we don't arm ourselves with the knowledge that is necessary, that is factual, evidence-based, data-driven, you know what kind of panic we're going to help to spread? So when they started calling, I just decided, okay, let me get to it. So when the World Health Director announced that it was a global health emergency, the work started. I mean, before that, I was paying attention. You know, you try to update yourself at the end of the day, a little thing here or there, but after that, it became my assignment, literally. So, where the panic came from, though, is what surprised me sometimes, because it's not always from people who are not in the know. A lot of times when you got the panic, it was from people who were authoritative, people in positions of influence, you know, and so that just made it even more difficult, because when you have somebody who's supposed to be an expert in the field, or somebody who is a medical practitioner, calling, doing an interview, and sharing this information, and the public is listening to it, they run with it as, okay, I'm getting this from this source, so it's good. Not always true either. So you're always in this position where even as the talk show host, I know that I have to be fact-checking even the people who I am interviewing. Yeah? So I know that when we're behind the mic, when I am behind the mic, I have to act as a buffer between what the listeners need to know and what the propagandists are trying to spread. I'm the buffer between factual information and untruths. I'm the buffer between scientific evidence and anecdotal data. The point is I have the responsibility to the listeners to know the difference between what is real and what is fake, what is panic and what is concern, what is fair and what is confidence. And a critical way to buffer out the misinformation, the lies, the rumors, the propaganda, is to ensure that the information that you're sharing is authentic, factual, evidence-based. So how do I do that? I try to speak to the people who I know are supposed to know. So for COVID, I invited the Ministry of National Security. I haven't gotten him as yet, but Lord, I think they're kind of tired of me because they say that it's a national emergency. I've tried to speak with the Minister of Health. Well, he was on, so I got a lot of information there. The CMO, he is supposed to come and speak with me tomorrow. The Prime Minister, because there are some questions that those people can't answer. One of the questions I posed to the Minister of Health, you know, all of these projects between China and Trinidad and Tobago under the Road and Belt Initiative, what will happen to them? He's not going to take that question. You know, so you try to speak to the people who are better able to inform you. And my apologies, I'll take this opportunity to invite somebody from CARPHA to share some information with my public, because it is really needed, yeah? So people generally express panic or calm and confidence depending on whether or not they support the government. That's something that I have experienced time and time again behind the mic. So those who don't support the government think nothing is being done, they don't try to source information in the public domain, and would generally have a sense of panic and hysteria about them. And for those who support the government, they're generally pleased with the dissemination of information and how prepared they think the country is, even in the absence of knowing the details of what is going on. So one of the biggest issues I've had to address behind the mic is treating with the fact that people's beliefs, truths, and responses are not always based on evidence, facts, and principles, but based on like, dislike, trust, or mistrust. Yeah? Sometimes it gets difficult to present the facts as you know them and to educate the public about what's indisputable as compared to what's opinion, because, as I told you, their belief system is not based on that. So I'm always mindful of letting the audience know when something is my opinion as compared to when it is fact. And it is so important to differentiate the two at all times. So in closing, I recognize that the media practitioners that were critical to the dissemination of information and managing the panic and fear, and that we have to arm ourselves with the right information before coming to the mic. We also have to know when to share certain pertinent information and when to hold back. And the reason I say this is, sometimes people call even during this, well, I can call it pandemic now, people would call and say, oh God, the deadly COVID-19. So in such an instance, instead of saying to them, over 4,000 people have died, I said, boy, over 100,000 have lived and beat this thing. The perspective makes the difference to how they react to what, you say. Instead of telling them that, listen, it's so deadly, tell them that only 5%. You do the comparisons, and the thing is, whatever you're telling them is that both of them are factual. It's just the perspective. So just understand that we are the buffers between misinformation and facts, but we're also the connection between our audience and those in authority. So let us ensure that we know our job, accept our limitations, and understand our audience. Thank you.
Thank you very much for that, Natalie. And it's something that we discuss in my newsroom every day, that those couple extra lines of context where you can balance the picture out. Typically, space is tight, context is the first to go, but in this case, that overall picture, not just the death count that we've, in some media outlets have published every day, but also those who have recovered from the virus. So we are now going on to our last panelist and our CARPHA rep with us this morning at our table, Dr. Stephanie Fletcher-Lartey, the CARPHA consultant responsible for communicable diseases and emergency response, and she's going to talk to us about getting our facts and our figures right.
Thank you so much. All of you have made some reference to the facts and the figures today, and Dr. St. John and Dr. Indar gave quite a bit of information about the facts and some of the figures already. I think it would be opportune for me to start off with one clarification in terms of words that we use. What is the difference between an outbreak and an epidemic and a pandemic? I think that is a good place to start, considering the news we just heard. An outbreak is usually a small cluster, or in terms of the health services, we usually say when there are 2 or more cases linked to a particular place or time or a person or event. So there's some kind of connection between these cases that we are seeing, and they're usually a fairly manageable number that the health system can manage, but it is above the norm that you would see, okay? And the definition for an outbreak will change depending on the kind of disease that it is. For example, for a foodborne disease outbreak, for 2 or more people, that could be called an outbreak. For other conditions, you might need 10 or 15. So it's contextual. An epidemic is when an outbreak is spread over a larger geographical area and can include more than one territories or countries, but it's not global. A pandemic is when, in the classical sense, is when the spread of an outbreak has gone beyond or has covered multiple regions, and the efforts to control it have somehow failed. So it has spread so wide, and the conventional or traditional routine methods that the health system would normally use are not readily putting it under control. And so it's a decision that is made based on the spread and the scope and the ability to control it. And so for the WHO today to declare the COVID-19 outbreak as a pandemic, they would have recognized that traditional efforts so far have failed to contain this within a geographical area, and it has spread to so many countries now that the immediate efforts might not necessarily contain it immediately, all right? So I thought that would be important for us to put some clarification on that, particularly in light of what has happened today, because I'm sure a lot of you will be getting questions and other people following up and calling and so on. My next statement, though, just in light of this, is that to declare a pandemic has also political undertones to it. When a country can activate certain protocols, there are laws that also can be activated when a pandemic has been declared, such as establishing a state of emergency. The government might be able to commandeer resources. The government now has that legal platform on which they are able to make certain decisions above and beyond what they could normally do on a day-to-day basis. So declaring a pandemic comes with a lot of legal implications and political implications, if I may use that word, also for leaders and government. So I just thought that while I'm talking about the facts, that is something that would be important to put up front. Now, to step back a little bit to the disease itself, a lot of the fear and the panic has been around some of the huge numbers that we have seen. Because initially, we heard about this thing a couple days, and then within a couple weeks, it doubled and tripled. And people, I believe, kind of panicked. What? So many all at once. It is because we're dealing with a very highly infectious disease that can easily spread through the droplets when somebody cough or sneeze. And this is what has happened in a place like China, where you have probably a very large population and lots of people out and about, even before you know something is happening. But if you look at the information coming out of China, the measures that were implemented fairly quickly have now been demonstrated to be very effective in containing this disease in China. Now, the reports we're getting outside of China are more than what are coming out of China. So to put this in perspective, the lockdowns in Wuhan and the mass quarantine actually had significant effect in containing the virus within those areas. Unfortunately, the virus got out before the lockdowns took place. And that is why now we are seeing the spread in so many countries outside. One of the things that the data is also saying to us is, and this may answer one of our journalists' remarks earlier about being in China and what happened. We really don't know the exact date when this happened. The reports we are getting and our information comes out of WHO, and the Director General just came back and put out a report, is that the earliest date that they thought this came out would have been very late November or early December. However, they would not have had widespread community transmission as we have described earlier. It would have probably been just those first initial cases that they had seen in hospital, and they were looking after those people. So for people like yourself who were in the area at the time, you are more likely that you were not exposed at all. What happens is when that widespread started to happen and more people began to come in contact with sick people, that is where it began to spread more widely. But looking at the global picture, the numbers we are seeing are the cumulative numbers. That means people have been adding up the numbers from the day they started to report. So the 109,000 or the 103,000 that we are seeing today is the numbers that we've counted from the day we started to report the outbreak. It doesn't mean that today, on the 11th of March, we have 100,000 people walking around with COVID. So the confirmed cases, and I need to clarify what that means as well. The numbers that we are reporting are confirmed cases. It means that these people have had a prescribed test that says we have identified the SARS-CoV-2 virus that causes COVID-19 from the sample taken from these people. It also means, from a health perspective, there are quite a lot of other people walking around who have not been tested. So when you put it in perspective, that is what we are saying. But let us use the confirmed cases because those are the numbers we have, all right? When you look at the numbers of confirmed cases that we've had today, over the time that we have been receiving these reports, about 74% up until today's figure, which I just calculated, have been reported from China. Outside of China then, we have another 26 or so percent that represents the rest of the world. So let's put it in perspective. About 74% of the cases that have been reported so far are cases that are linked to China or its territories. The other 26% that are outside of China, the vast majority of those, are about 90%, are actually within 4 countries. South Korea, Italy, Iran, and I think Spain has bumped up, and France is borderline on that as well. So when you look at it, the vast majority are focused within a little area out of the rest of us outside of China. That's where the bulk of the cases are, in that area. So just to put it in perspective, so those are the numbers of cases we're seeing. Now let's talk about the people who get sick. The data coming out of China, and they had the bulk. So most of the data we are relying on is from China, because they had the big numbers that they could actually generate figures for us. About 80% of people who have been infected and who have been diagnosed so far have very mild illnesses. Some of them hardly had any symptoms, or just really mild flu-like symptoms, or just like the common cold. And most of them did not require hospitalization. And we believe similar would happen. The vast majority of people would not even need to see a doctor, just as is normal. Then there was another 15% or so who were more severe, having symptoms such as the pneumonia or the acute respiratory distress that required them to go into a health facility to be assessed and to get some kind of management, because we currently don't have any treatment for the disease. Then the last 5% represents that group who are the ones who have become overwhelmed by the disease, and a lot of them have ended up critical, and some of them have died. Now, in this group, the severe and the critical group represents a kind of unique proportion of our population. These are the people with the chronic diseases or underlying diseases, such as the heart disease, the diabetes, the hypertension, the cancers, or any other kinds of illness or situation that reduces the ability of their immune system to respond or to fight off the disease. And that is the reality that we have seen from the data presented so far. So I just thought that it would be really important to put that in perspective. Now, to put this in layman's terms, it means that in the Caribbean context, should we have local transmission happening? Let's say some of the people who have been confirmed so far, they actually coughed and sneezed on someone and people actually got sick. The vast majority of these people might not even realize they have COVID. And they will go through their symptoms and recover as if nothing had happened. There will be that proportion, about 15 or 20 to 20%, who might end up in hospital and need some care. And then where the critical cases now, these are the ones who will need to be admitted to the intensive care units and will need some extra interventions, all right? And the message continues to be, the last thing I want to mention on this is the traditional hand hygiene that we practice is very, very effective in killing the COVID virus. So we should continue to repeat over and over and over again, wash your hand, cover your sneeze and cough. It is effective, and that is our biggest defense right now against COVID-19. Practice hygiene, cover your sneeze and cough, and if you develop symptoms and feel sick, see a doctor. And I will leave that at that for now. Thank you.
Thank you very much to Dr. Fletcher Larty.